Her speak on the topics of chemical testing on animals and her amusing father. We have also learned that she enjoys fishing and hunting and also loves to cook. Gabby first became interested in cystic fibrosis when one of her classmates in elementary school had it. She believes it's a fascinating disease. Ladies and gents, welcome Gabby.
Imagine being told you aren't going to live to attend elementary school. This is what about 30,000 kids are told in the U.S. who are diagnosed with cystic fibrosis. According to medicalnewsdaily.com, a website that provides medical news every hour, last updated April 2009, cystic fibrosis is an inherited chronic disease that affects the lungs and digestive system. In the next few minutes, we will be learning about the causes of CF, the symptoms, and some of the treatments. Cystic fibrosis is a hereditary disease. It is caused by a mutation in a gene called the cystic fibrosis transmembrane conductance regulator. This gene helps create sweat and mucus and digestive juices. As found on WebMD.com, updated April 2013, you can only get CF if both parents are carriers of this defective gene. The child must inherit 2 copies of the defective gene in order to get CF. A child with 2 parents who are carriers of the defective gene has a 25% chance of having cystic fibrosis and being a carrier of 2 defective copies of the gene, a 25% chance of not being affected nor a carrier of the defective copy of the gene, and a 50% chance of not being affected by CF but carrying one defective copy of the gene. Now that we know the causes of CF, let's talk about some of the symptoms. The symptoms of cystic fibrosis vary. Some children will have symptoms at birth, while others may not have symptoms for weeks, months, or even years. The severity of symptoms also varies, with some children showing only mild digestive and lung problems, and others having severe food absorption problems and life-threatening breathing complications. This is a picture of the affected lungs. They're like all filled up with mucus. And then this is a picture of a normal lung. According to CFF.org, which is the Cystic Fibrosis Foundation, a website educating people on CF updated May 2012, the most common symptoms of cystic fibrosis are frequent coughing, wheezing, or bouts of pneumonia. Also, they have difficulty breathing that keeps getting worse, and a big appetite but poor weight gain. Even though cystic fibrosis has many bad symptoms, there are some treatments that can help the severity of the symptoms. In early diagnosis of CF, a treatment plan can improve both survival and quality of life. Follow-up and monitoring are very important also. Lung problems are treated with aerobic exercise and other therapies to thin the mucus and make it easier to cough up out of the lungs. These include a percussion vest or a manual chest percussion. Some other treatments for lung problems include antibiotics to prevent and treat lung and sinus infections. They may be taken by mouth or given in the veins or by breathing treatments. Oxygen therapy may be needed as lung disease gets worse. Lung transplant is also an option in some cases also. We now know the causes, symptoms, and some treatments of cystic fibrosis. Even though both of your parents must be carriers of the defective gene to get CF, I hope none of your loved ones are told they won't live to attend elementary school.